What's up, guys? Look, Dr. Chris Park here, and I was thinking it's time to get a new video out there, an update on Suboxone tapers, Suboxone, Subutex, buprenorphine, etc. A video especially for people who are trying to stop this medication and who've had issues due to withdrawal in the past. So we want to try to taper this medication without withdrawal. Now, all right, disclaimer. This is just information. You need a physician. You need your own doctor. I am not your doctor, so this is not specific medical advice for you. This is just information that you can use to think about and to talk to your doctor about, okay? Again, and then the second thing is not everybody needs to be tapering, okay? The most important thing is that you're, you're stable, that you're off of opiates, and that you're not at risk for relapse. And that, if you're good with your recovery or whatever circumstances in your life, you're needing to taper off medication, or you're just like tired of taking it, or maybe you're having bad side effects, and perhaps you've tried, but you've had severe withdrawal, then I think this video could be helpful. Now, for many of you, if you've seen my other videos, you know that I typically use an alternating dose approach to tapering. So like, let's say you're on 16 milligrams of buprenorphine a day. So that'd be like 8 milligrams twice a day. That's kind of a typical dose for a lot of folks. Well, instead of just dropping it down from 16 milligrams a day to 12 milligrams a day, I oftentimes will just have like once a week, we take 12 milligrams. The other days you take 16. Do that for a month. Then the next week, twice a week, so Monday and Friday, we'll take 12 milligrams. We'll take 16 milligrams the other days. Then the next month, you can go Monday, Wednesday, Friday at 12 milligrams, and then the next month you can swap it and take your Monday, Wednesday, Friday can be your high dose, and your lower dose is the other days. And then the next month you can go 2 days a week at a higher dose. You can alternate like that and just kind of make incremental changes, but that is accumulating over time progress. And that's the key. And that builds momentum. And momentum is essential. And it also gives you, some psychological benefit. You know that if today is your day that you're taking a lower dose, well, you don't have to worry too much about it because tomorrow you get to take your higher dose. So if that kind of freaks you out mentally, you've got that safeguard. So we're working on it in two different ways. We've got your physical withdrawal taken care of. We've got your psychological issues taken care of. And so that is, I think, a very good method. I use a very slow approach for folks. That might be too slow, but you can always speed that up. You could start with every other day, see how you feel, and then go the next month, drop it down every day at 12 milligrams. Then the next month, alternate 12 and 8, So you can kind of either go super slow with it, or you can go a little faster. And then here's the other thing is, maybe you go super slow one month, you go faster the next month, then you slow it back down. You can adjust this based on your needs and the circumstances in life. Okay, so that is like my overall arching template for tapering. Now, we make individual adjustments, but that is typically the technique I use to start with. Now, when it gets to low doses, when we get below 2 milligrams, it gets difficult. So the first thing I try to encourage folks to do is to change their prescription from 8 milligram tablets or strips to the 2 milligram tablets or strips. And that seems obvious, right? Because it's easier. It's gonna be easier for you to cut these up. It's gonna break them up or whatever that you have to do to keep tapering. But the problem is cost, because the cost goes back up when you get more of the 2 milligrams, because I believe the cost is almost equivalent per tablet. So a 2 milligram tablet and an 8 milligram tablet is about the same cost, I think. So if you're used to, you've tapered down and you're on like, you get like maybe 10 of the 8 milligram tablets a month, and now all of a sudden we're going to 30 of the 2 milligrams, well, then the cost goes back up. So that kind of becomes a problem. But let's say that's not an issue. You can go down to 2 milligrams. Well, then you can keep using this template, right? Now, until we get to 0.5 milligrams or 1 milligram. Now, once we get to that dose, I typically like to, instead of trying to cut it further, I try to spread out the timing of when you take it. So if you're taking it every morning and so every 24 hours you take a dose, and you're at 0.5 milligrams every 24 hours, but you still have withdrawal, then I will try to push you out every 26 hours. And this is where you got to set an alarm. You got to write things down. You got to take notes because the timing is going to get really weird. I literally had a patient do this, and she would set an alarm clock, and she would get up in the middle of the night to take her dose. But she stayed on our clock, so every 26 hours, then every 28 hours, after a couple weeks or a month or whatever, and then every 32. And then once you get to about every 48 hours, you'll be fine to stop. Every now and then I might have somebody have to do every 72 hours for a while. Now, let's say that doesn't work for you. Let's say you can't push it. Like, you're fine as long as you take 0.5 every 24 hours. But you can't go down lower. You can't get to 0.25 without withdrawal. And you can't go to every 26 hours without withdrawal and just feeling horrible. Another option is changing over to a Butrans patch. Now, the Butrans patch is a transdermal, because it's a patch, goes on your, it goes on your chest, I guess, and it will release into your system through the skin, okay? Now, there are some problems with it because you change your patch every week, and usually by day 5, it's not sticking anymore. There's issues. But the highest dose of the patch is just about equivalent to the 0.5 milligrams of the tablets or strips. I even had a guy go from very high dose Suboxone straight to a patch, and he had 0 withdrawal. But I think he's more like the exception than the rule. But anyway, I'm just saying that is an option. Now, the patch, the reason you probably haven't heard of it or it hasn't been offered to you is because it's approved for chronic pain. And so it's not one that's usually thought of for opiate dependence, but it is buprenorphine. It's the exact same medication. So just in a lower dose. So that's easy. So we can go to the patch. Once you get in the patch, you don't want to just completely stop your Suboxone yet. Get on the patch, get it in your system, and then after the second week, you start to taper your tablets or your strips, and you can do that quickly now, right? You shouldn't have to wait too long to taper because you've got the patch in, you've got a continuous amount of buprenorphine in your system now, so you shouldn't have withdrawal, okay? So, and then with the patch, you've got good dosing there that you can, every month you can go, okay, I'm a 20 microgram patch, then the next month 15, then the next month 10, then the next month 5, and then you should be good to go because the dose is so small. That is an option. Now, let's say you can't get the patch. Let's say you're having a little bit of trouble when you're on the 0.5 milligram dose and you can't get lower because of withdrawal. That's when I would usually use medication, other meds that like clonidine, which is a blood pressure pill, but the way it works, it will blunt some of the effects of the withdrawal. Now, just remember, it doesn't take the withdrawal away, so it's not the same as like Suboxone or Sublocade. So don't expect to have the same result. But you can take a clonidine and it will help you. It'll help you relax. Now, sometimes it makes people drowsy. So I do have some people who could take it during the day, and some people can't tolerate that. So it's just kind of person dependent, But I've written it for folks before to take like every 6 hours as needed, and as long as they didn't have like side effects of low blood pressure, dizziness, or just weakness or drowsiness, they could take it throughout the day. Sometimes I will use Neurontin. I know some addiction specialists don't like to use Neurontin because there is a chance of drug liking and there's some issues there. But a lot of my patients have like chronic pain anyway, so some of the tapering it is not so much the withdrawal as like the pain coming back and trying to figure out, okay, what's pain and what's withdrawal. But sometimes I'll use Neurontin. Sometimes I'll use other meds that help with anxiety, or I might use medicine for restless legs if that's the big issue. And usually when we add those, and then we can just kind of keep going with the taper. We can kind of speed up the taper a little bit actually, and just kind of get through it. You know what I mean? So that we pick a time. Okay, what's a good time in your life that that you can go through some withdrawal? But again, we're minimizing the withdrawal. This is not the same as just stopping the Suboxone or Subutex cold turkey. We're trying to minimize withdrawal with other medications while we're still using a tapering protocol of the Suboxone or Subutex. But the difference is when we're adding these other meds, we can taper a little bit quicker, just realizing, yes, there's going to be withdrawal because there's no way through it at this point. You know what I mean? Like, we've tried all the options, and this is our best option. Let's just taper through, have some withdrawal, but blunt the effects, okay? Now, all right, so that is I'm trying to think if there's anything else I wanted to cover. That's the basics, right, of my tapering techniques and templates, if you want to call it that, or whatever. Again, we have to make adjustments based on the patient's individuality and their needs. Now, something I didn't talk about, and we'll back up. Let's say you're on 16 milligrams a day of Suboxone. You want to taper, but you just can't. Well, another option is you could change over to the Sublocade shot. It is a once-a-month shot. Yes, it goes in the abdomen. There's kind of like a marble-like knot in the belly. When I say in the abdomen, I'm sorry, it goes right under the skin in your belly, so it's not like actually in your guts or anything like that, okay? But it's a little weird for some people. And anyway, and then that medicine just kind of slowly dissipates over the month. So some people will do the first few months of those shots and then just kind of stop getting their shots, and it just slowly tapers itself. And some people have had really good success with that. And so that, and to me, I honestly, I kind of think that's probably one of the better ways to do it. It's just a problem in getting people to do it, getting it paid for, living with some of that discomfort of getting a shot in your belly. It just seems kind of weird to people. But from reports I've heard, now I don't have a whole lot of personal experience with this because I just can't get patients to do it. But from the reports I've heard, there doesn't seem to be as much like the post-acute withdrawal and stuff like that either. And so I'm interested in that, and I wish they would do some studies on that so we could know what's the best method to prevent post-acute withdrawal. So post-acute withdrawal is not like the withdrawal symptoms you have like during the moment. It's kind of like what happens a month later when you've been off medicines for a month, but you're like super fatigued and you're depressed, and things like that. So that is like another topic, right? And that sucks. And there are some things we can do. And let me back up again. So I always try to encourage people, if you're going to go through something difficult, prepare yourself. And that's mentally and that's physically. So you need to be eating healthy. You need to be drinking lots of water. You need to be exercising. You need to make sure your nutrition's good, and your other, like, how's your blood pressure doing? If you have diabetes, is that well controlled? You need to get these things under control, and that's going to help you with your taper. Not because it makes the taper easier, even though it probably does, but because it helps you to deal with the problems of life. Like if you're healthy, you're going to be able to deal with stressors better than if you're unhealthy. If you're unhealthy, it's going to be more difficult. If you're unhealthy, you're going to have fatigue at a baseline in some ways. You know what I'm saying? Like your recoverability is going to be already impaired to deal with anything. But if you get all that, healthy and I'm saying the same words over and over. If you get all that under control as best as you can, you're going to be in a better place, okay, to face this difficult road. But what I'm trying to also show you is that there are techniques, there's templates that you can follow, that the road doesn't have to be so difficult, okay? But that's not to say that it's not. And it takes some mental preparation. And I don't like, necessarily willpower. It takes more discipline than anything, right? But you're disciplined. You can do this. Like if you got off of opiates, you've been compliant with your Suboxone or Subutex, you've changed your life, you've got your finances back in order, you've got your relationships, in a better place, you've gone to recovery meetings, you've done all that. Like you're disciplined. You're a different person now. So use the skills that you've acquired out of necessity to recover from your addiction. Use that for something positive as you go forward. So, all right, guys, I hope this video was helpful. If you have any specific questions, let me know. But again, I want to remind you, I want you to talk to your doctor. I cannot give you specific medical advice over the internet, nor would you ever want to try to get specific medical advice from somebody on the internet. What you want to do is just get information, think about it, okay, and talk to your doctor about it and see, okay, would this method work for you? All right, guys. Have a great day. God bless. Peace.